Okay, so our next program is to talk about how housing affects health. And we have Brigetta Olson here with Willamette Neighborhood Housing, and she's going to come up and give us an update on how things are going from that perspective. And then we will be happy to take questions and answers with her as well, and then we'll have a time for broader questions and answers at the end.
Great.
Thanks.
I'm shorter than most folks. Thanks for having me. Again, my name's Brigetta Olson. I'm the Deputy Director
There you go.
at Willamette Neighborhood Housing Services. And our mission, we're committed to improving lives and strengthening communities through quality, affordable housing, homeownership, economic opportunity, and community partnerships. We're celebrating our 25th year. We've been around and we were founded by the city of Corvallis back many, many years ago. And since that time, we've expanded our service area. So we serve Linn and Benton counties for our homeownership development activities and Lincoln County for homeownership promotion. We own 382 units of affordable housing in Linn and Benton counties. Just last Friday, we finished and folks got to move into our newest development in Northeast Corvallis for veterans. So 8 veterans got to move into a new home that took many years in the making for us to achieve. But one of the gentlemen who's a veteran, we now have a big school bus outside of one of our units because he was living in his bus for a long time until we were able to find him housing. He's now living in one of our units and is happy as can be. So it takes time to develop our housing. We're in a housing crisis in the state of Oregon, and there's much more need to be doing more of that throughout our state. So we develop affordable housing. We also have asset building programs. We have homeownership center where we teach folks about managing their money, buying a house, and then if they're having issues making a payment on their mortgage, avoiding foreclosure, and negotiating mortgage terms with a lender. Next slide. In recent years, I guess recent being the past 6 years or so, we've become the convening organization or lead organization behind the Linn Benton Health Equity Alliance. So we're a group or alliance of multiple organizations all working on upstream strategies to keep folks healthy in the first place. We know that a zip code defines people's health outcomes over time, and that's not okay. And so as a coalition, as a group of folks, we're working on barriers and policy and system change to make sure everybody in our community can be healthy. So examples of some of our work, we started with the Benton County Health Department. They were the brainchild behind this initiative. Since that time, Willamette Neighborhood Housing Services has taken on the coalition guiding and convening, and we get money through the Oregon Health Authority, disseminate it out to other community organizations. We've been working on tobacco-free housing, leadership development with community members, wellness councils in the schools, dental kits for kiddos, and healthy homes initiatives. Next. Other work that we do that's regarding health and upstream health is we're really focusing on targeted neighborhoods, knowing that when multiple organizations all work together and have a common goal, you're able to achieve more. So it's called collective impact. And so for about 6 years, we've been working with many different other organizations in the region, including Benton County Health Department, City of Corvallis, and the like, and really having a complete South Corvallis, knowing that Southtown is a lower income neighborhood and has many access barriers because it's away from downtown, although not far. The path or 99 doesn't feel safe for people to walk on. There's not an easy bicycle way for people from downtown to get to Southtown. And so we've collectively been working together on creating policies and opportunities for the community. Willamette Neighborhood this year, or the past couple years, has been really doing more grassroots organizing with community members to see what folks want. What do folks want in Southtown to have a healthy community? And many of the things that keep on coming up and again within community members is people Southwest 3rd is unsafe. Lincoln School is right on Southwest 3rd, dropping off kiddos to their elementary school. Parents and kids don't feel safe. Speeds are really high on that street. There's no full-service grocery store. There's no financial institution. There's no medical services besides the Benton County Health Department, which is a great asset right next to the elementary school. But people are lacking resources and are really working together from a grassroots level to try to bring about positive change and find financing tools and the like to make that happen. Next. So we do what we do because home matters. You know, I think about my family and what home means to me. I have 2 kids at elementary school, and at the end of the day, you know, I look forward to sitting around a kitchen table with my kids, sharing their days, their successes, their failures, and sharing a meal together. And home matters to everybody, and I go to work every day because everybody should live in a safe and stable home. Everybody should be able to thrive and be surrounded by a community that cares. So we know, you know, some concrete things about healthy habits take root more easily in stable, affordable homes. Children in stable homes learn and achieve more in school. When a kiddo is going and living in the same home year after year, going to the same school, building relationships with the same school teachers and the principal, they're going to do better in school. And so stabilizing people's lives by affordable housing is critical. Next. So I should have made the links between housing and health a long time ago. I was a Peace Corps volunteer in maternal and child health in Morocco and working on HIV/AIDS education in Kenya. And then I started, you know, working in affordable housing, and my 2 careers are now meshed. But there's a lot of great work happening in the state of Oregon associated with health and housing. There was a core study up in Portland that included 145 housing properties with 3 different housing types. So it was family housing, permanent supportive housing, and senior housing for seniors and people with disabilities. And what they did is they studied the long-term effects of people's health when they get into affordable housing. Key outcomes that has been proven is primary care visits went up after moving into affordable housing. Emergency department visits went down. Primary care visits went up by 20%. ED visits or emergency departments went down by 18%. That's a huge cost savings and better health for the residents. Residents reported that they had access to care and quality of care improved after moving into housing. Fantastic. And then integrated health services were a key driver of healthcare outcomes. And you know, I think as I've worked at Willamette for 14 years, some of the key learnings I've taken on is learning that cross-sector partnerships matter, and you can do a lot more when you're working across different sectors. And so healthcare and housing are critical to stabilizing people's lives, keeping them healthy in the first place. So our pilot with Intercommunity Health Network included 2 components. One is health navigation services that connect residents to healthcare and social services to be delivered where people live. I had this hypothesis that people are going to be more apt to participate in services near them. You know, if there's a community room that's 2 doors down, opposed to driving downtown or getting on a bus and trying to engage and figure out parking and all that, people are going to be more apt to participate in certain programming. And that takes time, and I'll talk more about that. The other component, so that was health navigation services, I'll talk more about that shortly. And then the other component was health and housing planning. We, as a housing developer, want to do a better job. We're doing a good job, but we want to do a better job of incorporating other ways to deliver services through either healthcare at our housing, best practices for senior housing, and how to coordinate those efforts and bring in the supportive services directly to our residents. So we're looking at a health and housing plan that's focused on senior and permanent supportive housing for residents. Next. Our project goals were to increase utilization of preventative health care appointments, much like the core study, enter into an MOU with healthcare providers to deliver on-site programming, and then to develop the health and housing plan. And so the Navigators, or community health workers, build relationship with our residents and offer one-on-one coaching to address health concerns. They're working on community building to engage with the neighbors, learn about medical services, and address physical and mental health wellness. The services are based on each individual property and community's need and individuals. So example in Corvallis is we own Lancaster Bridge, which is in northeast Corvallis. And there is food insecurity concerns during the summer months. So what we did last summer is that we offered school lunches in collaboration with the school district and USDA. And after that, free summer lunch program that was provided on site in our community room opened up to the greater community. After that, we had kid wellness programming and activities. We did hikes around Jackson Fraser wetlands, which is really in everybody's backyard, and really trying to engage the kiddos at that property in wellness outcomes and programming. We've also worked on writing groups at one of our properties. So we own the Julian Apartments in downtown Corvallis, and wellness programming at that property. And it really is specific to each different property. Each property has their own resident leaders that we work on developing those resident leaders over time, and the health navigators add the support to help them be successful at engaging the community. Other component is housing stability. So eviction prevention services. We offer financial education to our residents and the wider community. We'll take $50 off of people's rent if they participate and graduate from our Dollars and Cents workshop, knowing that when you learn how to manage your money over time, that will help add personal assets and wealth over time. Next. So some of the successes, not only did we have MOUs, but we offered dental screenings. We kept on hearing from our residents. They were really concerned about dental care, access to dental care. And so we had a dental screening in collaboration with Benton County Health Department. It was offered at one of our co-sponsored sites, Corvallis Family Table, which provides a healthy takeaway meal for families in South Corvallis that's offered twice a month. So we have the dental screenings there. So you go where people congregate already. You deliver added programming, and it was a great success. We had loads of folks coming. We had people from Lincoln County wanting to come over and get the dental screening there. And then we also offered it at the Hotel Julian Apartments in our community room. And then we've also been able to do barrier-free yoga. So adding a yoga class. This is across from Lincoln School. This is our Alexander Court Apartments. We co-located with CardV. So the yoga is at CardV. We have childcare that's free and accessible. Residents are able to get this free service, and then with childcare provided. And then the housing stability. Actually, we've been able to help 17 households with eviction prevention services that helped stabilize their lives. And sometimes that means talking to the property manager and feeling what kind of barriers they're having. Sometimes it means finding emergency rental assistance. Other times it means there's a crisis in somebody's life, either mental health, and we're trying to link them up with appropriate providers to make sure that they can stay in their home. Other successes is the entryway. This is the entryway of the Julian Apartments. Through some of the community building efforts and leadership development, amazing artists live at the Julian. Last summer they had an art show to show off their work with their community members, and pretty amazing artists that live there. Next. And then individualized assistance. So we work individually with people one-on-one to address their concerns. And that takes time. Just as human beings, it takes time to get to know somebody, to open up to somebody. And when we got awarded the pilot, it takes a while to get to know the residents. But over a couple months, one of our health navigators kept on coming to a property week after week, hanging out. And all of a sudden, a person who she'd interacted with for a long time just came up to her and said, I think I need your help. I'm not able to do everything I can do. I'm not able to survive happily in my apartment. It's exhausting for me, and I need extra supports. And through that relationship, our navigator was able to link up with the Council of Governments, Senior and Disability Services, get some home health care support, 20 hours a week in her home. And she realized that she had been really exhausted and depressed and needed mental health services. And through a couple more months went by, She started coming out more of her apartment. She started realizing that she had amazing assets. She started organizing the community members and get social gatherings and cookie gatherings and really bringing up her concerns to the residents and talking about it. She now wants to work on an emotional toolbox that she can help people identify sort of their challenges with mental health, which as a society we don't do a good job of talking about, which I love that she's bringing this forward. And working with the residents. So she's been an amazing community leader who's thriving and happy and stabilized. And then the last slide is just a little more about our health and housing plan. So we've learned a lot hanging out with public health people, and I'd like to say I'm almost a public health person now too. And we want to develop new affordable housing in the future that links up with many of the supportive services that we know people need to thrive. And so that includes, we're going to be looking at senior housing, maybe senior co-housing in the near future development, and what kind of best practices are out there in the nation and worldwide that we can bring to our properties, to bring to Corvallis. And then the other component is supportive housing. Too many people in our community one person is too many to be homeless in our community. So right now we want to do a better job of identifying some of the financial resources to help, one, develop more affordable housing, two, when we develop it and get folks who are formerly homeless into their housing, get them the proper support so that they can be successful and stay there. Questions? Our waiting lists are a problem, in the sense that we have a long waiting list at most of our properties. I would say we urge people to go ahead and get on the wait list because the wait lists do move and it depends upon each different property. There's always a need at the state. We're in a housing crisis and we need more money to develop affordable housing, quite frankly. And there will be opportunities tomorrow. Health Equity Alliance, I'll be presenting about how to talk about housing and how the best practices associated with that. And we're hoping to bring a group of folks up to Salem to talk to our legislators about the need for affordable housing in our community. Yeah.
Can you say something about the building that will be built at the site of the men's winter shelter?
I can't because we don't know yet. So the men's shelter, which is on 4th Street, we are looking to acquire that property at the end of the term of this shelter, but we don't have plans yet. We're working on the financing and the packaging of that, but we don't have plans, but we'll be working with the community and of course identifying the population and the needs. But once we know, we're happy to share, yeah. Any other questions? Thank you.